Are they having a picnic over there? Without us?
Say you never about it is way I put it. I be your eye never clear. Mankind's a wicked. I talk about my government.
You know something, Zozo? Every August 1st, Emancipation Day, there used to be a big picnic in this park.
What's Emancipation Day?
It was a day that celebrated the ending of slavery. I don't know if you read about it in school, but
No.
there was a time when people would take other people, and because of their skin color, they would seize them, take them away from their families,
Why?
because they thought that they were less than humans. And they didn't accept it at all. All kinds of people, all kinds of races, they became involved in the anti-slavery movement. And eventually slavery was ended, and the day it was ended, August 1st, 1834. So every August 1st, for a long time, in this park here, people would come together to celebrate the ending of slavery. So that's the story of Emancipation Day.
Wow. Thank you for telling me that.
Okay, are you going to go to the library and do some reading on it sometime?
I don't know.
To me, Emancipation Day means celebration. It serves as a reminder of the oppression my ancestors faced back then and the oppression my people still face today. Emancipation Day means strength and resilience.
To me, Emancipation Day means freedom,
family, celebrating Black history,
awareness, learning more about my family history,
the opportunity to learn, especially for our young people, so they can know about where they came from, so they can be proud of their heritage today.
It means freedom, it means change, and it means movement toward the future.
Hello, everybody. Welcome to our first panel discussion for our Emancipation Weekend celebration. We're so happy to have all of you here with us, and we have an amazing lineup of discussions for you guys. So you are now tuned into our anti-Blackness and community health panel discussion. Before we jump into that, I first wanted to acknowledge the land upon which we gather as the shared territories, traditional territories of the Haudenosaunee and Anishinaabe people, protected by the Dish with One Spoon Wampum Belt. This historic peace agreement between the Iroquois Confederacy and the Ojibwe and allied nations represents a commitment to share and protect the land, water, plants, animals with respect. We wish to honor the original peoples of this land and express gratitude for the opportunity and privilege to work with communities across the territories. The parallels between the injustices between the Black community that we face in the Black community and the ongoing fight for justice for Indigenous people in Canada and around the world cannot be ignored. Both are a reminder of Canada's shameful history of colonialism and racism, which still exists today in many forms and contributes to the disproportionate impact of HIV on the BIPOC community. We at Matter of Black believe in diversity and inclusivity. We commit to a culture of inclusion. We add our voice to the call for change. Radical equality matters. Upholding basic human rights matters. Doing what is right matters. Black lives will always matter. Today and always, we stand in solidarity. So we are going to jump into this discussion. We have a great lineup of panelists. So I'm going to start it off with Dr. Alexandra Ezeonu, who is a community physician and health program manager specialist. She received her medical training from Nigeria and the United Kingdom. She has 10 years programmatic and technical experience implementing donor funding HIV TB prevention, treatment, and care services. She led the CRS Global Fund HIV treatment program that reached over 20,000 clients in Nigeria. She is currently a research fellow at the Center for Translation and Implementation Research, where she is contributing to implement science research on preventing the prevention of mother-to-child transmission of HIV in Nigeria. Welcome, Alexandra.
Thank you, Musta. Hello, everyone. Good to have you here today.
Yes, and then so next we have Lydia Collins. She is a Black queer writer and sexual health educator with a focus on HIV prevention in African, Caribbean, and Black communities, which is also ACB, and decolonize consent education. Lydia is the author of 3 self-published chapbooks of poetry. She released Angry Black Woman in January 2019, To Everyone We've Ever Been in September 2020, and In Transit in February 2021, and produced a short film in October 2020. Joy is Our Birthright, that highlights Black, queer, and trans joy. Lydia's lived and professional experience in community health motivates her to continue amplifying marginalized voices. Welcome, Lydia. And then we have Erica Williams, who is a registered social service worker, and through her employment at various shelters, she recognized the need for hair and beauty care products for Black women. So in 2018, she created Erica's Embrace, and which is now called Erica's Embrace Support Services, which donates hair and beauty products for Black women to shelters in Ontario and provides Black advocacy to community members in the Niagara region. Welcome, Erica.
Hi, everyone.
And then, last but not least, we have Kattawe Henry, who is a Brock alumni with a Bachelor's of Arts in Sociology and a Master's of Arts in Gender Studies and Feminist Research from McMaster University. Kattawe brings a background enriched with experience and understanding of the difficult conversations that are essential to developing lasting and effective change. She is moved by the resilience of marginalized communities and has committed her research and professional career to understanding the themes of racism, mental health, and sexual violence and harassment to understand and draw parallels to the social and structural nature of racism. Welcome, Kattawe.
Hello.
And then I will be facilitating this amazing conversation. My name is Mutsa Charamba. I am also a founder of Matter of Black. I am the education director of Erica's Embrace Support Services, and I am the African, Caribbean, and Blacks support coordinator here at Positive Living Niagara. We're so happy to have you guys here so we can touch on some of these issues here. So let's jump into it. So as a member of the Black community, we face a lot of health challenges and a lot of stigmas as well. One of them, which is HIV and AIDS, which is basically an unrecognized pandemic within our community. So to start, Alexandria, how does stigma affect mental health within the Black community?
Thank you, Musta. So I'll start with defining stigma. Stigma is a powerful social process that devalues an individual or a community and is based on perceived differences. It can be based on gender, it can be based on age, sexual orientation, or your race, ethnicity. So, and stigma leads to discrimination, which is the unfair or unjust treatment of individuals based on socially identified status. And when you have this negative attitudes, it can lead to a number of prejudice and negative actions and as well discrimination. So just to inform us that everybody can be affected by stigma. So both those in primary school, those that are still in the schools, adults, aged, they can all be affected by stigma. And then what are the consequences? Stigma can be very serious and devastating. You can have people having serious pains, fear, anger. They can be intolerant to others. It can also affect their psychological well-being as well as health-seeking behavior. So when you have a lot of difficulties, lower self-esteem, poor quality of life, feeling of shame and doubt, it can affect your mental health. And so we have stress coming from stigma and discrimination affecting our mental health as Black individuals. So you also have physical trauma that could be a result of stigma affecting you indirectly. Black people are more predisposed to chronic illnesses because of the stigma that they experience in the course of their daily livelihood. So it also predisposes them to mental health issues. And then you have the social interaction whereby there is some form of isolation. They are excluded, so it also affects your mental health. And when your mental health is affected, it affects your functioning. Now we know that Black individuals are more likely to be affected by anxiety disorders as well as depression than the average population. And then we also know that only 1 in 3 persons that are Blacks and affected by mental health issues seek help. So this brings us to the issue of how we can address these issues. What are the barriers that we are having at Black community in addressing our mental health issues? So number 1 is stigma. So we need to destigmatize mental health issues. So we know that according to WHO, World Health Organization, health is a complete state of physical, mental, and psychological, social well-being. So you cannot isolate your physical well-being from your mental well-being. They should all be equally treated. So when there is some form of stigma within the Black community about mental health, it affects our health-seeking behavior. It's a barrier to seeking help. So we need to destigmatize stigma within stigma of mental health within our community. And then we have to address issues of belief within our community. So sometimes we feel that it's something, mental health is something you can snap out of. It's something that can easily be addressed. You don't need to seek treatment for it. It's a form of moral defect. You can act on it on your own. No. Just like when you have physical injury, you need to seek help. Also, when there is any form of mental health issue, you need to go to those that have been trained to handle the issues. Then again, sometimes we are not able to draw the line of when to seek help. Sometimes we believe we are strong. As Black individuals, we've been able to overcome so much. So you believe you can easily handle it. You have to just be strong. You have to hang in there. There is so much expectation from the community on how you need to address this. Yes, but you need to seek help for your mental health issue. Now, again, we can have issues of self-help where someone wants to address it by self. You go to drugs, trying to do 1 or 2 things to address it on your own. But then going into substance abuse can also aggravate the mental health illness. And again, some other barriers is isolation. Some people can just isolate themselves from the community, from their social networks in order to address mental health issues. And that doesn't work. You need to come up, you need to speak up about this. And again, there is the faith-based solution where we try to address it spiritually. Yes, a lot of us in the Black community, the first person they speak to when they have mental health issue is the clergy. But then it's good to speak to someone. They would provide some level of support, but we need to draw the line where spirituality affects your healthcare. So you need to know when to seek help, apart from the support that you can also get from your church and your congregation. So these are barriers that we face as Black individuals regarding our mental health. And then how can this be mitigated? You find out that within the healthcare system, Black individuals have some form of lack of trust because of the way they have been treated in the past regarding issues about their health. So there has been some form of abuses in the past. The Black community has been used for experiments that they wouldn't ordinarily consent to. So it brings up a barrier and prevents them from seeking healthcare. Again, Black individuals are 2 times more likely to be misdiagnosed when they have mental health issues, and that becomes an issue for them. So if you feel that you're going to have the wrong diagnosis, why would you want to go? But still, it's important to seek mental health. This thing you have to seek help for mental health issues. Then again, we have been exploited in the past, and then they are more likely to be included in researches where they need to discuss about how they feel and how they've been taken care of. And you cannot use researches that have been done in other populations to address issues within the Black population. Again, we also have the issue of involuntary treatments. So we find out that the Black people are more likely to visit their family physician when they have mental health issues or go to the emergency as against visiting a trained psychiatrist. So now, sometimes when they eventually seek help against their will, they are giving treatments that they don't want. So these are all issues that have been affecting us. Again, we have critical shortage of trained healthcare practitioners. There are few Black people that have been trained to address issues of Black people. So that's another challenge. And then we have the cost of healthcare, which is health insurance. And if you remember, when we are racialized, it affects our opportunities. And when people are not gainfully employed and they don't have access to health insurance, it becomes an issue to provide the cost you need to seek mental health issues. So these are all what we are going to be discussing. How are we going to rise up as a community to address this issue and support each other? Thank you.
Awesome. Thank you so much, Alexandra. You touched on so many issues of just stigma and the distrust within our community and mental health and all of these topics that we usually are not open to talk about, or we were raised not to talk about, because again, we don't really get an opportunity to explore our mental health issues within the Black community or explore any type of stigmas, right? So I thank you for bringing those things up. And these topics are definitely something that needs to be addressed, definitely. I would like to, that makes me wonder, like, how is it that our community can cope with this stigma and this all these things that we face? How is it that we can, because we hear about how we are challenged with all these things, how are we going to cope with it in a way where we're going to be able to somehow progress from it?
Thank you. So, yes, we can all, as a community, deal with issues of mental health. First, we need to talk openly, just like you said. So we need to speak up about it. Those that have mental health challenge, they need to talk about it. Talking makes it better for you. As a community, we have to have this form of discussions where we talk openly about mental health issues. We need to educate our community. It's an ongoing process. We have to continue to educate ourselves. And then thirdly, we need to continue some form of advocacy to ensure that we have enough competent, trained healthcare workers to deal with mental health issues, as well as making sure that it is culturally appropriate for us, because there are some cultural dimensions to it, which has to also be addressed. Again, as a community, getting some form of social support is very important in dealing with this. So relating within your family, within the Black community, it has been shown to greatly improve mental health issues as well as issues of stigma. Being supportive to each other, we can lift each other, we can help each other. Again, it's important to seek attention when it is time. And in the course of seeking attention, you can make certain requests within the health system. You can ask for a form of healthcare provider that understands your issues, the issue of stigma that you have been facing, and you will be able to have someone that tailors the care to you. It has to be individualized for you as a Black person. So these are ways that we can go about it. And lastly, which will come up to later, we need to advocate for ourselves. We need to be able to speak up for ourselves. Thank you.
Thank you so much, Alexandra. I really do appreciate that. And yeah, it is very important for us to have these discussions to make this normal. I know within the Black community, when it comes to HIV and AIDS, there's definitely a barrier there where people are not comfortable to speak on it. And so something that people don't know is within our community, Black women are now disproportionately the highest, almost the highest when it comes to HIV transmission. And this is from monogamous relationships. And a lot of people don't know that because we don't talk about that. Because what platforms are we able to talk about this from? And the stigma, it stops us from being able to talk about this. And so a lot of these women are living with HIV, not even knowing that they have HIV, because testing is something that is also stigmatized on, because it's believed, well, if you have to take a test, you must have it, right? So these are some of the stigmas that we do need to break within our community. And so I'd like to bring it to Lydia. Why is it important to normalize regular testing and taking care of our sexual health?
Well, I love how you just said too, Mutsa, how that stigma around testing, that idea of if you're testing, that means that you must have it, right? So I think often when we think of HIV testing, we think of it in the context of crisis, right? So I think many of us can think back to maybe the first time we got tested, and we were probably, so consumed with fear, right? We went after doing something, behavior that we might have considered high risk. And so that's kind of how we viewed testing, is because we only did it in moments, again, of crisis. And the issue with that approach is that not only it amplifies stigma around getting tested, because it's seen as something that we do as a consequence rather than a precaution. Right. So it's like, okay, what did I do? And it puts a certain amount of blame and guilt on people who are getting tested, right? And saying, what am I doing that leads me to the potential of having to deal with this consequence, right? Which goes much deeper into the ways in which we view HIV, the ways in which we view the people living with HIV, and the ideas around what kind of people we think get HIV, which in reality is anybody, right? And so also, not only that, but from a more clinical perspective, that approach also isn't useful to only go in moments of crisis, because HIV has a 12-week window, right? So if you are in a situation and you think, oh, well, this situation makes me have to go, to get tested, and you go right away, you might not have an accurate result if you're going before that 12-week window is up. So from that perspective, it's also not super useful and not giving you kind of the adequate results that you need. And also, one thing I've heard a lot, especially from young people, is I've never had sex before, so I don't need to get tested. But these are like the same people who will tell me, I've never had sex before, I don't need to get tested for HIV, but they're going to like the dingiest basement to get a tattoo, right? With unclean needles and getting like, not checking if the needle is new when they get piercing. So understanding all of the different ways that this virus can be transmitted too, right? Because some people through vertical transmission, their parent had HIV, right? And just gave birth or breastfed. So there's all different reasons. And I think kind of understanding that more allows people to realize, oh, anybody can live with this virus for any reason. And it's not a consequence, and nobody did anything wrong. It's just something that can happen to any of us. And some of us, based on social determinants of health, might be more susceptible to it due to certain reasons, whether it be geographically, access to care, all these kinds of things, right? And also, there's a lot of stigma historically around Black folks and around queer folks and trans folks when it comes to HIV, right? We know that in the kind of earlier epidemic of HIV, it's very much known as like the gay disease or the Black disease, right? And those kind of stigmas still very much exist in a lot of social settings and circles and media coverage where we hear this kind of stuff. And so another thing that's dangerous is that that's not only harmful to folks who might be Black or queer or both, or racialized in general, but it's also dangerous for folks who don't identify within those margins, because they're not given that care, or that access to testing because they're told to not worry about it. And I have friends and folks who've come to some of my workshops who've disclosed to me that, I'm straight cis man, and I asked to get tested during my regular physical, and my doctor told me, like, why would you want to get that? You don't need it. Are you doing anything risky? Are you having sex with men? Okay, cool. No, you're fine. And people I know have even been denied access to an HIV test because their doctor has been so adamant on them, they haven't done anything wrong, so they shouldn't have to feel a need to go do that. And kind of keeping all of that in mind, this idea of regular testing is so important for me because a lot of times in my work, I talk a lot about radical self-care, right? So this idea of pushing further past that kind of mainstream idea of self-care that we have that usually requires money. So you can get the bottle of wine or the bathtub or go, take a night out, and instead pushes more, which are all great things, but this instead pushes more, for all people, kind of depending on wherever you might be, whether you can, afford or have the time to sit in a bath or drink a glass of wine, a way that focuses on taking care of ourselves and our wellness on an intentional and ongoing basis, right? So part of that looks like getting tested, going to doctor's appointments, going to the dentist. And of course, these things obviously, again, have to do with class because not everybody has access to just go to the dentist or go to do these things. But I think when it comes to testing, especially, there's so many resources and free resources and access to things where people need to be really prioritizing that. And at ACHO, where I work, we have a campaign called the Care Collective, which Mutsa, you're obviously familiar with, yes. Where it focuses on encouraging Black women to get tested and to know their HIV status and to incorporate it as part of our regular self-care routines, right? Mm-hmm. Because in Ontario, we see the data. We know that when it comes to the cases of women living with HIV, Black women are at about 54% of the women who make up that statistic. And so knowing that we are disproportionately impacted by HIV, especially when we think about the fact that Black women are constantly taking care of everybody else, but many of us, like Mutsa, are walking around not even knowing our status because we didn't have time or we didn't think about it, right? Or we figured, I think I'm okay, I'm in a monogamous relationship, or I don't do drugs, so I don't have to worry about that, and all these different kinds of things, right? So really, really, for me, the importance of getting tested and normalizing regular testing really ties into self-care and just taking care of ourselves on an ongoing basis that we all need to implement.
Yeah, no, I definitely agree. And also it's funny that you mentioned even your friend going to try to get a test and them being turned away, because I've had that experience as well, where I went to my doctor and I just asked for a routine checkup. And I asked for HIV testing as well in that routine checkup. It's not that, there's something that I just wanted a routine checkup. And he said, well, you're not promiscuous. You're not this, you're not that. You don't use drugs, so you don't need it. Right. I had to be persistent with him for him to be able to give me the test. So imagine those women that do go in there and they do listen to their doctor when their doctor says, oh, you're not promiscuous. You don't need to take it. Oh, no, there's no need. You're good. And what if they do have it from being in their monogamous relationship? So having these conversations, I feel, is very important because we do need to move away from this thought process of HIV and AIDS is a promiscuous disease, or it's only a gay man's disease. Like, I don't know if you guys have been keeping up with the media. There's been this uproar this week about this certain entertainer who had gone on a homophobic rant and telling people, oh, if you don't have HIV, put your cell phones up, if you're not going to die in 2 weeks. And that goes into the misinformation that our community has. And that's why these conversations are very necessary to have, so that we can move away from this place of ignorance and move into a place where, okay, now we have the information and we're able to, use it wisely. And so basically, and also, Lydia, you did mention the Care Collective. With the Care Collective here at Positive Living Niagara, because we do want to encourage women to take care of themselves and self-care, and that includes, getting tested. we have self-test kits available here at Positive Living Niagara. All you have to do is contact me. You can contact me at 905-984-8684, extension 113, or by cell phone, you can contact me as well. And that is 289-407-9760. And then I can get you your self-test kit to you. The lovely thing about this self-test kit is you can do it in the privacy of your own home by yourself. You do not need to go to a doctor's office, even though that is an option. But if you don't feel comfortable going into a doctor's office, you can pick up this test kit, take it home, get the test, and then make your choices from there, right? So that is something that we do offer here at Positive Living Niagara, and do not hesitate contacting me to get any of those. So yeah, Lydia, you did touch on a lot of great stuff. And then it leads me to think, how do we make that shift in the narrative surrounding ways in which we prioritize our sexual health?
I think we need to start holding sexual health to the same standard as the rest of our health, right? If you break a bone, and Alexandra, you kind of alluded to this earlier, but if you if you break a bone, you know that you need to go to the hospital. Or if you are feeling unwell mentally, you are probably going to seek a therapist or some kind of mental health resources. So why is it that, when it comes to sexual health, it's something that's considered so taboo that we don't even think of it as an option if we're feeling unwell in something pertaining to our sexual health? And sexual health isn't just getting tested, right? Sexual health is pap smears and mammograms, and there's so many things that fall into the realm of taking care of our sexual health and ensuring that we know our statuses. Regardless of what your status is, it's important to know so that you can make sure that you're taking care of yourself the best way possible, because we know, right, that HIV is no longer a death sentence, right? People in Ontario, the cases of people dying from AIDS is very, very low. The chances of people developing from HIV to AIDS is very, very low in Ontario, at least, because of the kind of advances in medicine and in research and the access to care that we have now that we didn't have even 30 years ago. And so, when you're able to kind of take care of your health, regardless of what your status is, and have access to these things, it makes a world of a difference. I think even when you think about, I haven't got a physical in a long time, you would book a doctor's appointment, or, I haven't gone to the dentist in a long time. Not that there's anything wrong with my teeth, but I haven't got a cleaning in 2 years. Why have I not called the dentist? Same thing with normalizing, sexual health, taking care of your sexual health in a routine kind of way of, I haven't gotten tested for HIV in over a year, and I've switched sexual partners, or I've, used drugs and I don't know how clean the supplies were, or I got a new tattoo and I don't really know the person that well, or I can't remember checking if I, saw how clean the needles were. Or even if none of those things happened where it seems high risk, you just simply say, I haven't got tested in a year. I should go, even if I'm in a monogamous relationship, right? So yeah, I think for me, part of that shifting the narrative is being able to have these conversations in a real way, right? Really asking questions and providing spaces where these questions can be asked free of judgment. So normalizing sexual health education in places like church or other places of worship. When I was at Somerset West as a strategy worker, that's one thing that I implemented was I'm trying to remember the name now, Our Sacred Health. So essentially, we would talk to people who are part of faith communities, ACB people from faith communities, and just kind of ask them of their experiences of understanding sexual health, and not in a way of demonizing their religion, not in a way of questioning their faith in regards to sexual health, but simply just in a way of understanding, for you, what kind of access did you have to sexual health, and how has that kind of shaped your relationship to your sexual health as an adult? And for many of them, they were saying they spend so much time in their places of worship. Why don't they have access to sexual health information there, right? A lot of these young people in church spend, some of these people, some of our grandmas had us in church from Friday, Saturday, Sunday, all day evening service. So if you're spending all this time here, why don't you have access to information that you need as a young person or as a person in general, right? These are people that you trust. These are communities that you know, may spend a lot of time with. Why don't you have access to that information? So I think those are the questions that we need to start asking. And at the end of the day, it's up to you to advocate and to prioritize your own sexual health. Nobody else can do that for you. So we really got to think about asking the right questions and equipping people with the proper tools to ask those questions and get the care that they need.
That's definitely correct. We definitely need to be our own advocates, and we need to know what questions to ask. We need to know when to push for ourselves and our health within our community. That's definitely true. So then that leads me to Erica. What is the correlation between intimate partner violence and HIV?
Well, Mutsa, you mentioned earlier that Black women are amongst some of the highest new cases of HIV, and many of them are in heterosexual and monogamous relationships. So intimate partner violence increases the risk of contracting HIV. If you have an abusive partner who might force you to engage in sex, or an abusive partner who forces you to engage in risky sexual behavior, it's about power and control, right? So if you're at the receiving end of that abuse, you're going to feel less empowered to negotiate safer sex practices.
Right.
Some abusers, they purposely prevent their partners from accessing supports and services and healthcare. Or at times, sometimes they can even, I've heard from some, intentionally infect their partners with HIV, just to cause them to stay with them as a means of control, once again. And then a lot of times, some abusers they're going outside the relationship, right? They're engaging in sexual activity without their partner's knowledge. So we really need to take a look at the relationships that we have in the Black community, and we really need to challenge what we've been taught is a healthy relationship and what that looks like.
No, definitely. Why would you say that, like, this is a significant concern for Black women specifically?
For Black women, I would say because we can have so many different intersection of identities, right? So we're looking at an intersection of race, of gender, of class, and with those intersections, and then we also have an intersection of stigma. So if you are now living with the stigma of having HIV and then the stigma of being in an abusive situation, now you have double time, right? So because of that, you're going to be least likely to reach out for supports. And a lot of time, the supports that you connect with, at times, you can experience a lot of racism. If you look at the first point of contact, usually we have domestic violence shelters, right? A lot of Black women are more reluctant to reach out to these spaces because we've already identified that a lot of them are not safe. They're not culturally safe. They don't offer culturally appropriate services and supports for the Black women who are going in there. So it can be more problematic that we have these organizations that are not aware of the supports that we need in our community. And another issue too is a lot of times the staff that are in these organizations to support the women who are coming in there are not properly trained on anti-Black racism. And what that does is it makes, more of a challenge for us with our mental health.
No, most definitely. And also, I'd like to pinpoint just the train when you spoke about the training on anti-Black racism. A lot of people ask, "How can I help? What can I do as an ally?" Well, taking classes and workshops that can help you learn these tools is very important. And we actually do have a workshop that we are going to be holding on Saturday at 3 p.m. with Warren Clark. He will be doing a private anti-racism, anti-oppression workshop. To be able to be a part of that, you do need to register. The link is on our page. And so it is going to be a closed event. It's not going to be streamed like this event because we want to make it a safe and open space for people to speak. And this is open to everybody. So don't be afraid to join that discussion because this is something that will help you be able to help others, right? And I think it's important, I think Lydia did touch on this, how with Black women, we tend to just help other people first before we help ourselves. And I think that does go into why now we make up about 55% of new HIV diagnosis because we're helping other people and we're not really thinking about ourselves, right? So you just wonder, what is that doing to our mental health as Black women? Mental health is something we don't really talk about often, right? So that leads me to wonder, because there's not really a lot of Black people that are speaking on mental health or that you can get mental health advice, because I know for myself, even looking for a therapist, preferably I would like to find a Black therapist within my area because I feel like, okay, well, they might be able to understand me better than maybe a white therapist or anything else. And it's hard to be able to find that. So you have to use the resources that you have. And most times it just really doesn't work out, right? So Kattawe, I just wonder, what are some of the hypocrisies that surround common mental health advice we see in white dominated societies?
Absolutely. So, I mean, there's a lot of things that I could talk about that question all day, so I will try and keep it brief. But one of the things that's often ignored is some of the pieces that Alexandra was talking about, as well as Lydia and Erica, is that racism in and of itself impacts all of these things. So, when we're talking about stress and the way in which stress can kill you, you know what I mean? Like we all have that one uncle or auntie that's like, stress will kill you. It'll kill you. And it's true, right? Stress manifests so many different ailments. The way it sits in the body is incredibly powerful. And experiencing racism is stressful. Living in a society that wants to kill you is incredibly stressful. So when we think about mental health advice, we're often, I think it's great to talk about stigma, but I think a lot of the reasons that folks kind of steer away from other pieces of the conversation is because stigma and focusing solely on stigma individualizes the problem. It's about the individual and the stigmas that they experience rather than acknowledging that the systems that we live in create mental health disparities. Growing up poor is mentally damaging. Growing up in a society that wants to kill you, or you see people on TV who look exactly like you dying every day and showing that death for the need for even somebody to feel some level of sympathy, a la various things that we see now on social media, because we live in a day and age where racism is being recorded, where you can actually see the actual live death of somebody, to be the catalyst as to why some people actually take the time to care. So when we think about the mental health advice that we see, it's always focusing on stigma, but it ignores things like class. It ignores things like how racism is a class issue, but it also takes into consideration that no matter how much stigma we talk about, like depression or anxiety and all these other things, we're not acknowledging, where does it come from? Like if I fix, the people around me are more open to having conversations about mental health, but we still live in a racist society where, my kin are being killed every single day, it's not going to get any better. Talking about it is not the key solution to systemic issues. We can't just, talk away years of colonialism. If it was that easy, we'd be in a different society. You know what I mean? We'd be able to live in that day and age where you could reach through the phone and grab that beautiful picture of food off of your Instagram and it would just be ready and be made. Maybe we'd have that technology, but we don't, because we're still sitting in a society where, we prioritize racism and racist ideologies. And then additionally, I want to highlight, the piece around what you just said around finding a therapist that understands your background, because then what ends up happening, if you don't, you'll spend a lot of time educating your healthcare provider, and you're paying to do that, and that's part of the time, and then you have to kind of give them the prerequisites for the conversation to even deal with your certain issue, and then that they're not coming through a lens of understanding, but more of just what you've taught them and a teaching response. And, that can be quite damaging. It's like I saw a meme from Get Out where it's the mom with the teacup when she's stirring her tea. And it says, when the person leading your mental health therapy session is the reason why you need mental health therapy. And it's so real. It's so true. Like, we've seen videos. There was just one of a woman, a Karen in Victoria's Secret, right? Yeah. Those people have jobs, you know what I mean? And some of those people are working therapy. And when we think about the hesitation that a lot of people have, you don't want to be gaslit by your therapist that, oh, well, is it really racism? That's why you're, feeling the way that you're feeling, because that's, a really big tool that's utilized in a lot of spaces where the person that you're talking to doesn't understand your lived experience. So they start to gaslight you, whether, intentionally or unintentionally, to, question and reimagine and rethink of what you're feeling or what you've experienced.
Right. No, most definitely. I definitely agree. And I think that we need to start looking at it for what it is. When it comes to racism, it is creating a mental health issue within Black people. Okay, because some people might be labeled, oh, why are you so aggressive? Why are you so mad all the time? Why are you so this? Why are you so that? Because, like Kattawe was mentioning, like I see my people being killed every other day. I see these little microaggressions every other day. I've grown up having to normalize being treated differently. So yes, that creates a mental health issue for us, right? So I also wonder, Kattawe, do you think the linkage between mental and physical health is considered thoroughly when it comes to us?
No, like not even close. Like Lydia said, you break a bone, you go to the doctor, your teeth need cleaning, you go to the dentist. I think that when we talk about the linkages in similar vein to the physical and the mental, we act as if they're separate. And we do that with a lot of things. Prime example, this pandemic, right? We've been sitting in a pandemic for the better part of 2 years, and people are acting as if it's fine. We're fine, that we're traumatized. We all have PTSD, and we're experiencing mass death, mass disease, and just not necessarily knowing, like living in a heightened space of anxiety for the last 2 years, but whether or not you're going to catch coronavirus, or if you have a cough, you can't go to the grocery store and sneeze anymore. Right. People are like, ugh, and we've been living, we've been living in that space for the better part of 2 years. We've been living in a space where we can't go out. People are getting depressed. Right. We have concerns around folks taking their own lives. We have concerns around not being able to see our friends and family and our support networks, which has led into a lot of conversations around prison reform and things like that as well. But we haven't really acknowledged the ways in which pretending to be fine and going to work every single day, especially in the age of like George Floyd and the protests and the responses that have come out after that, impacts our body. And the fact that, being isolated from people impacts your body. We've all, probably felt like maybe our hair or our skin has changed since the pandemic. Right. We've probably put on weight since the pandemic in a way that, feels unhealthy, right? Like there are healthier ways when we talk about like weight and also connections to fat phobia. But when we think about how it's taking longer potentially for our bodies to heal during the pandemic, just because we're so depleted of so many even nutrients and resources, because if you don't want to run to the grocery store every 2 minutes and get what you need to get as if you were before, people are probably eating more takeout and more canned foods and things like that, because produce is gone like that, and then you got to go to the grocery store tomorrow, and we don't want to be doing that. So thinking about those connections, but also thinking about the fact that it's not even a space where you can go and talk to your therapist in person. Like you're still doing even the therapy online. And sometimes that's the problem for folks. So when we think about, those linkages and those connections, I think that a lot of folks are seeing, their bodies respond in a way that they might not be used to when it comes to like physical ailments. We've seen, an uptick in long haulers when it comes to COVID. So even like COVID itself, like you experience symptoms, the better part, some people have gotten sick last year, March, and still experiencing symptoms now. You can lose your hair, you can lose all different kinds of parts of, who you identified with before. And we know that in our community, Black hair is political. So I think that thinking about that as well is really important. And tying even into that previous question around mental health in white dominant spaces, we see, and I'm going to use Velvet's talk as an example, advertisements that primarily focus on whiteness being the face of mental health, right? So the people who suffer are white. That's the narrative that's pushed in advertisements. And then, that's even the narrative that's pushed up in the brochures. Like you see a pickup brochure for depression, it's like a sad white girl crying, and and you don't see yourself reflected in any of those pieces, and there's no connection between the racism and mental health, so you feel left out. So what you see between the physical and mental, people don't necessarily go and check up on the physical and connect it to the mental, realizing that the stress or the depression might be the cause of some of their ailments, the reason why their hair is falling out, things like that. So we see that narrative, and then we get pushback from our own communities, as was mentioned earlier, where we don't talk about this. We prioritize things like faith over our mental health, which then the physical deteriorates further. And like I said before, stress can kill you. You can die from stress to the heart. You can die because your organs start to shut down. Listen, you need to take care of yourself, because you cannot pour from an empty cup.
Exactly. No, that's definitely 100% true. And you make me think of like just growing up in like an African household, and if you're telling your parents, "Oh, I'm stressed, I'm depressed," they'll ask you, "What do you have to be depressed about? What do you have to be stressed about?" Life. You know what I mean? Like it's not an open space. Like it's like we're not allowed to feel any type of downward like emotion, and even in the faith as well. Like how could you be depressed and you're Christian? You know what I mean? It's just a lot of barriers there. And then you mentioned about something that you mentioned made me think about how also with Black women, when it comes to, I think it's in the US and it might be in Canada, but just the issue within Black women giving birth in these hospitals and all the issues that they have to face in these situations. So what ways can advocating for oneself and others benefit our community members, such as in a situation like that?
I think, it works in a multitude of different ways. One being, for us, bias kind of mentality when it comes to the supports that you're getting. People who understand where you're from, where you're at, will meet you where you're at, because they're either have already been there or they are there right now. It feels a little bit more genuine in terms of the benefits that could come out of developing a relationship with community supports versus feeling like it's a voyeuristic kind of thing where somebody's coming in and they want to help you, and white savior complex and angel complex and all these God complex, right? It's more along the lines of, this is our community and we want to take care of our community, versus seeing somebody feel sorry for you and very, Sarah McLachlan, Arms of the Angel starts playing, kind of situation. So when we think about advocating, it's going to, work to ensure people feel supported by their own, which will then encourage them to support other people, including, their own elders or their young ones. We also see how people will be able to build relationships and build bonds through that advocacy, like having, like their own community support groups, other people that they can talk to, or connect people with resources, because, life is about who you know. And, that's one thing that so many of us learn in like end stages of university, when you've already submitted all that money for your degree. You're like, oh, it's the networking, isn't it? So, that's a big part of it as well. And I think it also gives a sense of purpose. We as human beings, for as long as human beings have been here, have been trying to figure out what the meaning of life is, what the meaning of our purpose is, what our meaning as individuals are, what is our meaning as a community, what does suffering mean, why do we suffer, all those kind of questions, big asks, big existential crisis questions. But I think when we we talk about community building and advocacy, it works to fill so many of those voids, answer so many of those questions, or help you realize which questions you might never get an answer to, but that's okay in a new way. So I think that, you know, when we have ideas of advocacy, it benefits not only ourselves, but our communities, not only our physical, but our mental. And, you know, you can learn so much about the whole world around you and ways to like define that world and ways to understand that world. Because, you know, we talked about ideas of hypocrisy. We also talked about ideas of stigma. And a lot of the time people feel and they understand that there's something might be off, or they might feel that somebody's speaking about them in a negative way, but they might not have the language to be able to apply what they're feeling in a way that they can communicate it. So when you start getting into these spaces, you might learn that language, and you might finally be having a way to say, oh, that's how I feel, or how I feel about myself, or how I feel about what other people have done to me. And you have those aha moments that I think are really rewarding, which would then, you know, work to educate the next generation. And then lastly, I think that it works to think of new ways to live in the future. So we like to talk a lot about Black histories, of course, you know, as we're having with Emancipation Day and Emancipation Weekend. But we often like to think of Black people and Black success as not something that we can think about in the future. So we don't talk a lot about like Afrofuturism or what it means to see Black joy, or like, you know, Lydia's work, how she talks a lot about joy being our birthright, right? So something that we look for in the future, Black boy joy, Black girl magic. And I know that, you know, there's a lot of politics around those kind of terms, but like very simply, like being happy and being connected and being supported and feeling fulfilled, especially for those of us that, you know, talk about the diaspora and how important community is for the diaspora, those who have been taken from their homes or you know, moved voluntarily or involuntarily, to have community in those new places. So I think that, you know, it works to create a future that we know we can achieve, that we deserve, that is long overdue, that our ancestors paid for, and we just, you know, kind of have to wear that crown. So I think community building can be a really great way to do that.
No, that's definitely 100%. I 100% agree with that. And I also like how, you know, we also do need to be unapologetically feel. You know what I mean? Because I kind of feel like as Black people, sometimes we hold back from how we're feeling because we don't want to be seen in a certain way. If something upsets us, we're kind of slow to speak about it because we don't want to be seen in a negative way with these stereotypes that have been put on us. But no, we need to come to a place where my feelings are valid. I need to be able to speak these feelings just like everybody else is able to speak these feelings, right? And so continuing to advocate and doing all these works, I think it is going to help in the future for us and the next generation to be able to do different, right?
Absolutely. It works also too, I think, to break generational curses, which is something that, you know, a lot of people are talking about these days on the internet, but it's true, right? Like we're talking about like abuse. We're talking about abuse. We get like racism is abuse. It's violence. In the same way that it might be a bit normalized for older generations, especially those that are like, I went through X, Y, and Z, and it's like, that's terrible. I'm sorry that happened to you. That's not a good thing that happened to you. And I'm sorry that, you know, you had to experience that. That's not the barometer for pain. Right. So I think that, you know, that's also another piece that needs to be played with a little bit more.
Yeah, no, definitely. We definitely have a lot of work to do with in our community. And it's very, I feel very privileged to be in a time where there's so many of us that are willing to step out and do the work, you know, and step out and just help start to create that change, right? So this next question is open to everybody. So when considering mental health in the Black community, what barriers are often in place that prevent access to resources? I know all of y'all want to say something, but one at a time.
I hate to be that person, but can you repeat the question?
Yeah. When considering mental health in the Black community, what barriers are often in place that prevent access to resources? So I think maybe what stigmas are there? What barriers do we face as within the Black community that prevent us from moving forward to accessing therapists or help?
That's one thing that I think, if I could jump in, is a big one, is class. Like, Lydia talked about self-care being like a classist issue, being a issue of privilege, a circumstance of privilege to be able to do your bath bombs and your spa days and whatever. Right. But in similar vein, access to resources, therapy is expensive. Getting to therapy is expensive.
Yeah.
Being able to take time off of work is not a luxury that everybody has, or being able to work therapy into your work day, or work it in after work and having a babysitter watch the kids, or, if you're providing care for a parent, or you're a guardian for someone else, having someone come in and take care of that person, because you're most likely not be able to bring them with you, and thinking about all those things. And then, even if you do get to that circumstance where you try and elevate some aspects of your life, there are other ways that, the actual healing can be interrupted, right? So for example, let's say you're in a circumstance where you're feeling a lack of self-worth because it's really hard for you to get a job, right? So you finally get a job interview, but you don't have anybody to watch the kids. And even if you could, you couldn't pay them because you don't have a job. So you bring your kids with you to the job interview, a couple tables over, right? From where you're being interviewed, and then you have somebody call the cops on you for abandoning your children, as has happened, we see in the news time and time again, to Black women. So when we think about that access, like quite literally getting there is a huge, huge barrier. And then even when you get in there, you don't even know if they're here for you like that. You know what I mean? Like, is it going to be a thing where you're just going to let me bleed on the floor for you, take my trauma, and then spit it at a conference about how you help this, poor, unfortunate soul kind of a thing?
Mm-hmm. Yeah, no, most definitely. And I did see on the comments, Nikita mentioned employment, housing, and income being barriers. Erica, did you have anything that you'd like to add on that?
I've noticed with a lot of Black mothers, they're scared to even voice their concern of possibly having mental health challenges, because they're scared, a lot of them, that will cause their children to be apprehended by CAS or facts, as we say it down here. So they suffer in silence, and they continue to suffer in silence. A lot of them sometimes experiencing depression after having children and issues like that. So it's because of the very the relationship that we have, and the way that our children are still overrepresented in child welfare. That is a barrier for a lot of Black women with children to seek supports and help, and acknowledge that there is a problem going on.
Mm-hmm. Most definitely.
And I think as well, a big thing that I've noticed as a workshop facilitator over the years is there's not a lot of access. There hasn't been access to actionable items. You know what I mean? And Kattawe kind of alluded to it earlier, right? Like, you can't workshop your way out of systemic oppression. So as much as I believe in workshops, as I am a workshop facilitator, I've really had to kind of massage the ways in which I facilitate workshops over the years, so that I'm kind of combining that theory with practical tips and resources as well, right? So for example, when I was a strategy worker, one of the things I would do is, yes, at my workshops, we would have conversations around HIV, stigma, testing, all these kinds of things. But then we would have our anonymous HIV tester who was my colleague, who would be set up there in the corner to do anonymous testing, so people could go in and out and do that, right? Or even things as small as always having food at my events. I'm not bringing a group of Black people together to sit and talk, and I'm not feeding them.
With no food? No.
Right? So like, these kinds of things that might seem smaller, these kinds of items or even at workshops, I've often provided bus vouchers or taxi vouchers, right? Like Kattawe said, even just sometimes getting places is the biggest barrier. So for me, a lot of times it's been kind of really thinking about those actionable items. For example, for a long time when I was doing land acknowledgements, I was just thinking, okay, this is what people told me to do, or this is what I saw on the internet. And then after a while, I had to think about, what is it in relationship to like my relationship to the land? And also, let me really think and reflect on what I'm actually saying here. Like, it's not, I can't just be like, okay, blah, 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 we're on stolen land, back to regular programming. Like, I need to really be thinking about this in a way that's authentic and real and actually useful. And so I started adding in a portion after the land acknowledgement where it would be like, decolonization is a verb. and I would focus on local or indigenous organizations to donate to, or that I've bought from, or we would have conversations about, you know, who we can support or ways that we think we can support people. So I think, like, for me, that's been the biggest part and the biggest add to my workshops over the years, is including those items, whether it be resources and actually giving out condoms and giving out dental dams and giving out money, right? Like free bus vouchers, free taxi vouchers, free food, like giving out things, access to clothes, like things that people actually need, that sometimes is simply what all they needed in order to be able to come out to the event. And for a lot of people, I've had a lot of workshops where I had folks who came in, young folks who came in, and I know they weren't necessarily there to talk about HIV. They were there because they needed a meal. So they grabbed a plate and they sat for a little bit, grabbed some condoms and left. And that's fine, right? So really thinking about those kind of more practical pieces while it's still incorporating that theory around this work and HIV prevention work.
Yeah, most definitely. Alexandra?
Yeah, again, another barrier to seeking mental health services could be the kind of language that we use. So if we have to classify people based on their mental health issues, it becomes a form of barrier, because I don't want to go there and then someone terms me as crazy, or maybe I'm going to the shrink, or the healthcare worker defines me based on my mental health diagnosis. So it creates a form of barrier. So we have to use more of positive languages that will make people want to seek care and not stay back.
Yeah, no, most definitely, most definitely. There is a lot of fear that is within our community when it comes to what they're going to be labeled as if they come out with whatever they're struggling with. So I think that's why a lot of the people in our community tend to keep it to themselves. And that's the worst thing to do, because it gets worse. If you keep it to yourself and you don't deal with it, it gets worse and worse and worse. And then the labeling still comes. You get what I'm saying? So it goes into this next one where do you think the origins around stigma have come from, and also mental health in our community, and how can we combat this? So yeah.
I mean, in the diaspora, at least, and I guess generally, colonization, like, it always comes back to this, right? Like, it's specifically noted that these mentalities are weapons and tools that have been utilized by colonizers to colonize and build empire, right? So when we talk about, for example, you know, misdiagnosis, or what you're being labeled as, right? As we just talked about, like, there's specific direct connection between Black communities and schizophrenia. It's always nicknamed like, you know, the Black people's disease, Black people's condition, but it was specifically weaponized during the civil rights movement. And the definition of what schizophrenia was actually changed to fit civil rights activists so that they could be en masse, you know, deemed as mentally unstable. You shouldn't believe what they're saying because they're questioning white supremacy. So when we think about like the origins of that, it definitely carries down, and we pass on what we know or what we don't know, and we pass that on to our next ones and pass that on to our next ones, and make it so, you know, you can't keep a job if you're, you know, defined one way, or even you can't get citizenship to some countries because you have to like sign that you're of like sound mind or whatever. And, you know, even like, not necessarily, then that's not necessarily what it means when you sign that, but the way that your community could bring you up could give you a lot of hesitancy around that. So I think when we talk about those origins, it's very clearly connected to colonial practices or coping with colonial practices, because, you know, things like alcoholism, drug use, you know, things like self-harm, like it's all coming and connected with experiencing mass trauma, feeling as if you don't have control over your life, which is all clearly connected to living in a society where you literally don't have control over your life. Like, you could die tomorrow, and not because, you know, it was your time to go, but because some racist person decided it was your time to go. So I think that when we think about those origins and ways that folks can combat that, I think we have to name it. We have to stay exactly where it is, being able to pinpoint where it comes from, but then also, you know, critique the the way that we're addressing the problem now and reimagining what that could look like in the future with now knowing what we know. So I think that, people like to think of things in a timeline as separate rather than like they're all part of each other. You can't bake a cake and just, throw the sugar, throw the flour, throw the egg in a bowl and be like, oh, it's a cake. No, you need to like mix it up. You need to bake it together and make something new out of it. So I think that that's how we have to kind of work on approaching ideas of mental health, physical health, community building, advocacy, all of those pieces.
No, definitely. I definitely agree with that. Just like having this discussion is one thing, and having those uncomfortable discussions as well, not just for our allies, but also as the Black community. We need to come together and have these uncomfortable discussions because there are things within our community that we kind of do to one another, one of them being the stigma around HIV and the stigma around mental health. We need to educate one another. We need to have these discussions. It's kind of like we're still in that bondage of slavery. Slavery ended a long time ago, but mentally, we're still enslaved. And we need to work on moving away from that, right? So I definitely appreciate you ladies, Alexandra, Lydia, Kattawe, Erica. I appreciate all of your points, everything that you've brought into this conversation. I'm really confident in knowing that a lot of people have taken a lot of great points from this discussion, and hopefully this will cause more discussions to happen. Right. And hopefully this will make people more comfortable with maybe coming and getting a self-test kit or asking more about HIV or mental health or any of these things that plague our community. Right. And so, yeah, just as Lydia also mentioned about if you do need any type of supplies such as dental dams, condoms, lubricant, again, contact me here at Positive Living Niagara and we will be able to get that to you. All these things are free, okay? All of these things are free. We're here to help. This is what we do here. We want to help uplift and better our community. One step at a time, whatever we have to do. So again, thank you guys all for joining us. And we have a lot of other emancipation programs lined up. Tomorrow, we're going to have a discussion on the Harriet Tubman movie. We have a whole bunch of great panelists for that as well. So you're definitely going to enjoy. And we also have the anti-racism, anti-oppression workshop that's happening on the Saturday at 3 p.m. with Warren Clark. Again, if you do want to partake in that, you need to register at the link. This is going to be a closed workshop so that everybody's able to be comfortable and just talk about their feelings and where they're coming from. We want it to be as interactive as possible. So please don't be scared. Anybody, Black, white, whatever you might identify as, you are welcome to come. You're welcome to come. And we also have our concert happening at 6 p.m. on Saturday. It's going to be outside of the Performing Arts Center. So you do not want to miss that because guess what? It's free. Everything that we're doing is free. Okay? Because we know that our people like free things, right? So please join us for that. And then we have our vendor fair with Black 0905. That's going to be happening on the Sunday. And also we have partnership with TV Jazz Fest. And they have a whole bunch of great performers that are going to be performing on the Sunday as well in celebration of Emancipation Day. This is huge. Emancipation is finally seen as a holiday in Canada. We must celebrate that this year. Okay, we have waited for too long. So yes, everybody celebrate with your families, go out there, support Black businesses, and teach each other, right? So thank you for joining us. And until next year, guys, bye.